I have patients from 18 to 98. I run the gamut, so I would say there's no typical patient. I think classically people think of, a cardiology patient being someone in their 60s or 70s who's had a heart attack, and often people hesitate to get a preventive examination, which I always encourage people to do if you have a family history, or especially if you're a diabetic, that people should not hesitate to get a preventive examination and say, what can I do to keep my heart healthy? Because the best cure is often prevention. Diabetics are one of the highest risk people for developing cardiovascular disease, even if their diabetes has been well controlled. Female diabetics, especially female diabetics of minority groups, we know are especially high risk. Black and Hispanic women. So I encourage those people especially to make sure they're not neglecting their heart health. The higher levels of blood sugar often can promote inflammation and plaque growth beyond what you would see in a person who does not have diabetes. It sort of changes the entire biochemistry of the vascular system. We think inflammation is a big mediator of heart attacks. It's often a trigger that can set them off. That's why any kind of viral illness like COVID or being overweight, being diabetic, having high cholesterol, having a lot of stress in your life, having autoimmune disease, all these things can increase inflammation in your body, and that can often be enough to make even like a 10% blockage, that soft plaque, break open and cause a blood clot to form. We know that anybody with an autoimmune disease where you have increased levels of inflammatory markers is at higher risk for developing cardiovascular disease. In addition, things like being just obese, being sedentary, all of that increases your inflammatory markers. And again, we think inflammation can be a driver of cardiovascular disease. Probably the best things you can do is make sure your blood sugar is normal, make sure you keep a normal weight, make sure you're doing 30 minutes of some kind of cardiovascular exercise every day. Often I have men who come in and say, I go to the gym for an hour every day, but they're just weightlifting, which weightlifting is great. I mean, that's good. It increases muscle tone, builds muscle, but you still need to be doing that cardiovascular exercise. Not smoking is key because that also increases inflammation, and just eating a healthy diet, cutting out refined sugar as much as possible, no processed food, no fast food, just very clean eating. I think especially I'd encourage women to get checked out. Often they're told by their families or primary care doctors that they're not as much risk because they are women. Although nowadays we do know that cardiovascular disease is the number one killer of women, and I think that mindset that it's a man's disease really has not yet gone away. So anyone who's a woman, especially if you're diabetic or you have autoimmune disease, I'd really encourage you to get a baseline cardiovascular examination. If you have an HMO, often the referral has to come from your primary doctor. If you don't, you can typically just call a cardiologist's office and make an appointment. It's really very easy.